A breast self-exam is an examination of the breast for changes or abnormalities. Adult women of all ages are encouraged to perform breast self-exams at least once a month. There are 3 ways to perform a breast self-exam.
Lying down. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around your right breast, gently in small circular motions, covering the entire breast area and armpit. Use a light, medium, and firm pressure. Squeeze the nipple, check for discharge and lumps. Repeat the steps for your left breast.
In front of a mirror, visually inspect your breast with your arms at your sides. Next, raise your arms high overhead. Look for any changes in the contour, any swelling or dimpling of the skin, or changes in the nipples. Next, rest your palms on your hips and press firmly to flex your chest muscles. Left and right breast will not exactly match. Few women's breasts do, so look for any dimpling, puckering, or changes, particularly on one side. In the shower, using the pads of your fingers, move around your entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and armpit area. Always remember that any changes or abnormalities should be discussed with your doctor or physician.
I am Dr. Claudine Ordonez from TMC Clark. So here I am because it's October and October is Breast Cancer Awareness Month. I would like to explain to you more about breast screening. So you see, breast cancer is very common in the Philippines and actually all over the world. So it's important that we know the value and appreciate the value of breast screening. Breast screening means that even if we don't have any abnormalities or we don't have any complaints, we come in for a physical exam or any sort of examination to make sure that there are no abnormalities in the breast. Beginning the age of 20, we recommend that a female do a monthly clinical self-breast exam, meaning a week or so after your period, you inspect and palpate your breasts. If you do this monthly, more or less, you'll be more familiar with the own texture of your own breasts and be able to report to us, your doctors, if there is anything new. Beginning the age of 30, aside from your monthly self-breast exam, we recommend that you do an annual clinical breast exam. So come see us once a year so that we can also do your physical exam for you and help you with any problems. Beginning the age of 40, aside from your monthly self-breast exam and your annual clinical breast exam, we recommend an annual mammogram and ultrasound. The mammogram and ultrasound are done so that we can catch anything that is growing in your breasts. Breast masses start very small, and sometimes you can see them early enough when you do your annual mammogram and ultrasound. So with breast cancer, we would like to catch it early. Breast cancer is really not preventable. What we want is that if ever a patient will get it, we catch it early so that cure can be possible. So once again, we hope to see you. It's October. It's Breast Cancer Awareness Month. Come in for your screening.
哪里？
A breast self-exam is an examination of the breast for changes or abnormalities. Adult women of all ages are encouraged to perform breast self-exams at least once a month. There are 3 ways to perform a breast self-exam.
Lying down. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around your right breast, gently in small circular motions, covering the entire breast area and armpit. Use a light, medium, and firm pressure. Squeeze the nipple, check for discharge and lumps. Repeat the steps for your left breast. In front of a mirror, visually inspect your breast with your arms at your sides. Next, raise your arms high overhead. Look for any changes in the contour, any swelling or dimpling of the skin, or changes in the nipples. Next, rest your palms on your hips and press firmly to flex your chest muscles. Left and right breast will not exactly match. Few women's breasts do, so look for any dimpling, puckering, or changes, particularly on one side. In the shower, using the pads of your fingers,
Move around your entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and armpit area. Always remember that any changes or abnormalities should be discussed with your doctor or physician.
I am Dr. from TMC Clark. So here I am because it's October and October is Breast Cancer Awareness Month. I would like to explain to you more about breast screening. So you see, breast cancer is very, very common in the Philippines and actually all over the world. So it's important that we know the value and appreciate the value of breast screening. Breast screening means that even if we don't have any abnormalities or we don't have any complaints, we come in for a physical exam or any sort of examination to make sure that there are no abnormalities in the breast. Beginning the age of 20, we recommend that a female do a monthly clinical self-breast exam, meaning a week or so after your period, you inspect and palpate your breasts. If you do this monthly, more or less, you'll be more familiar with the own texture of your own breast.
Good afternoon, everyone! If you've just joined us, welcome! This webinar is scheduled to begin very shortly in just about 5 minutes. We're just waiting for a few more participants to join us. If you're having trouble hearing me, kindly use the raise hand emoji in WebEx or type audio in the chat box. I repeat, if you're having trouble hearing me, please use the raise hand emoji in WebEx or type audio in the chat box. And if everything's working well, if you can see me, you can see the slide, if you can hear me as well and the music background, please give us a heart emoji or drop any emoji in the chat. I'll be waiting for your emojis. All right. So, yay! So I guess we are audible and visible as well. So again, we are going to begin our webinar in a short while. Thank you. 90 both in Facebook and WebEx, and there are still people joining us. It's quite exciting. Once again, this webinar is also streaming live on our The Medical City Clark Facebook page. And if you're watching from Facebook, be sure to share this webinar to your friends. What about let's give a shout out to those of you who are here. Let us know again if you have not typed down your location. Please do type them down, your name and your location, and then I'm gonna give a shout out. So let me just scroll up. I see the first. Let me give a shout out to Alright, Erica Gonzalez from Balanga, Bataan. Also, Charo Mariano from Pampanga. We also have here with us Sheena Marie from Angeles City here in Webit. Let me also give a shout out to Sheila Maspat from Angeles City, Christina Alfaro from Angeles City. We also have participants in our Facebook Live, Carol Basa of Nueva Ecija, Ces Santos also of Nueva Ecija. Good afternoon. Era Espanta of Pampanga. We also have here with us in Webex Regine from Cebu City. See, we are reaching Visayas as well. Ayan, magandang hapon po. Also, Alberto Manalo from Cabanatuan City. Okay, some more here. Angelica Simbran from Capas Tarlac. Good afternoon. Sophia Nicole from ACE Diagnostics Center, May Kawayan. Oh, Bulacan. Hello, good afternoon. Also, we have participants from Makati City, Arian Villafranca. Good afternoon. Good afternoon as well to Jenna Sagun of MMMH and MC Batak, Ilocos Norte. Lian Romasanta of Pasay City, Angie Ramirez of Santa Cruz, Laguna, Princess Marie of Pampanga. Oh, we have a lot more. Thea Lieno from Antipolo City. See, from south and from north, we are all gathered here this afternoon for this webinar. Okay, let me just read some more. Lieno from Antipolo City also. We also have here with us somebody from Baguio. Luis. Hi, Luis from Baguio City. Also, let me just scroll up. Okay, Adri Ables watching from Mandaluyong City. Luisa Bautista also watching, but from Olongapo City. May Quimson from Caloocan City. Daday Polinar from Cagayan de Oro City. We also have Joanna Bascara from Zambales. Ayan, kumusta kayo sa mga taga Zambales? We have Mary Ann from Pangasinan. Good afternoon. Christine Reso from Clark. Diana Macasio from Ilocos Norte. Dayan Di Maculangan watching from Lipa City, Batangas. Good afternoon sa mga Batanggenyo. We also have Nina Mosqueda and from Davao City. And please, if you just tuned in once again, welcome to this webinar. Marco Polo Sabate watching from Sacred Heart Breast Center, Tacloban. Thank you all for joining us this afternoon. Once again, if you are watching from Facebook, kindly share this webinar so that others will be also informed, much as we are informed, about whatever learnings we're gonna get from this afternoon's webinar. And if you want to shout out, if I missed anyone here in WebEx or in Facebook, kindly once again type your name and your location and I'll give you a shout out. I hope I did not miss anyone. But we are just so happy that you are here with us in this very important and I guess timely as well webinar. So let me introduce myself. I am Michelle Santo Tomas and I will be your host for this afternoon's webinar. We feel ecstatic that you are joining us here in this event. We are beyond excited over here because we did not expect the number of attendees to be this many. Thank you for staying with us. That's why we promise that will make it worth your while. Okay, but first, just some house rules. All right, because we want to make this webinar as smooth as possible. Let me just read rule number 1. Please do turn off your microphone at all times, except during the Q&A session. You may or may not show yourself during the session, and it's completely up to you. Rule number 2, questions and clarifications will be entertained after the talk. Although you may type in your question ahead of time, and we'll answer them in the Q&A portion after the talk. During the Q&A, you may also choose to turn on your microphone, or you may choose to type in your questions in the chat box. So the moderator, that's me, or the speaker will mention you before or as we answer your questions. Rule number 3, let us treat everyone how we would like to be treated. So hate speech, bullying is not allowed. So let's make this a safe space for everyone, right? Can we drop a heart emoji if you agree? Thank you, Erica Gonzalez. How about the others? Let's make this webinar a safe space for everyone. Rule number 4, of course, let's have fun and always keep an open mind. I mean, just as myself, I know that I will learn more, by just attending this webinar. Thank you, Ariel and Villafranca, for your heart. Princess Autor, Jem, Rowena Malgat, Rachel, I hope I pronounce your name correctly, Rachel Accordon, and Christine. Thank you. And to everyone who are also participating through our Facebook Live. Thank you. So, now some expectations check. This webinar does not include 100% hands-on activities. So, don't worry, you can relax. We won't quiz you or anything like that. So, you also do not need access to a laptop or a desktop either. So, this webinar is totally accessible using your mobile phone. So if you're using your mobile, you can relax. You don't need to switch to your laptop. However, we do recommend the use of headphones with a good microphone so you can understand this much clearer, and vice versa, especially if you would really want to intend to unmute later on in the Q&A portion. All right? Again, are you ready? Can you drop an emoji in the chat box if you are? Let's give a shout out as well to Jeneline Aringo of Marikina City and Liza Alfonso watching from Pampanga, here with us in WebEx. Good afternoon. And thank you for your heart reacts. And I personally, I'd like to thank you for making this webinar as interactive. All right, so let's begin. Hello once again, and welcome to Breast Health 101, a webinar about breast health and beyond. This webinar is brought to you by the Medical City Clark Breast Center. They offer state-of-the-art technology which allows breast-certified radiologists, physicians, and a multidisciplinary team of healthcare professionals to detect early signs of breast diseases and provide a holistic approach to prevention, detection, and treatment. To be honest, if I may, I was so excited to be part of this webinar because as a woman myself, knowing that I'm healthy and having the knowledge to keep my breast health in check, right, properly and regularly is so important to me, especially my breast health, because as we all know, breast cancer is the leading form of cancer worldwide. And as a woman in her 30s, I want to be as healthy as I can be to continuously work for my dreams and look after my family. And perhaps some of you can relate to that. I'm just curious, how many of you around here are the same as my age, around 30s? Can you comment in the chat? If you're in your 30s, let's be proud. Who among you here in their 30s? Yes, Erica, you are? Yes, we're proud of that. Let me just check in our Facebook Live as well. Okay. Oh, 30 and happy. Yes. That's from Joanna Bascara. Thank you. Yes, I'm proud as well. Or maybe you are in your early 40s. Are you? It's now reached perhaps the menopausal stage and you want to take extra care of your body. May I know who are in their 40s or 50s? Yes, Nisa Alfonso, 40 plus and proud. How about in our Facebook Live? Oh, Azzy. Sorry, yes, Azzy, 30s. Luisa Bautista, thank you for being proud of your age. Well, let me just give a quick shout out as well. There are some of us in Facebook Live watching from Zambales, from Bataan, Cagayan de Oro, Caloocan, Olongapo. Thank you for tuning in. Thank you, Son, in our Facebook Live. Thank you for sharing your age with us. Ayan, so we are in the 40s or 50s, or maybe there are some of you undergoing puberty, or you want to be informed about, the proper breast care at your age. Again, let us show our hands. Comment if you are in your teens or nearly 20 years old. We have some young people. Yes, feeling young, and then the young people with us in our webinar. Thank you, Lou Cortez. Dating Savio in your Facebook Live. Thank you. We are with you here in Facebook Live. Hi, Jem, 28. Wow. Do we have anyone else in WebEx who's around 20, early 20, late 20s? Why we are asking this, Jem? Yes, Angelica, thank you. Princess as well. This is, I would say that is remarkable, Camille. Honestly, I believe that, and it was mentioned in the previous video before we officially start, right? That the earlier we get informed about the risks, right? And of course, we can take prevention, and in breast health, probably cure it earlier, right? If we are aware of it. So kudos to our young people in our webinar. Sometimes we spend too much attention on one or two aspects of our health that we get to neglect its entirety, right? Lalo na tayong mga mommies, we actually give our all for the health care of our family members, that we tend to forget to also seek regular check-up or perhaps check it ourselves, right? Can you drop a big yes in the chat if you also want to feel confident about your health, if you want to make sure that you have a healthy future ahead of you? Carissa, that was a quick yes. Thank you. Jeneline, Alingo, Marites Hernandez. Again, thank you for making this webinar as interactive. I'm very happy that we get to, interact through the chat box, and we perhaps later on in our Q&A we'll be able to, engage more. Thank you, Erica. Let me just check in our Facebook if there are some comments. For those who are watching our Facebook, again, you are one with us. I am checking once in a while our Facebook Live so I can also read your comments. Thank you for the responses. Because you see, we cannot continue with our caring for the others if we don't take care of ourselves too. That's why let's give ourselves a pat on the back. Come on, let's do that now. Let's give ourselves a pat on the back. If you're comfortable turning on your video, yep, that's great. If not, it's okay. give yourself a tap on the back, for taking that first step in making sure that your breast health is in the best shape. Before I introduce our speaker for this webinar, we've prepared a mini game for you. Are you all ready? This game is super simple, and for those who will participate, of course, we will pick winners before the end of the webinar. Who's up for it? Yes, I can see your emojis. Thank you. Yes, Erica, Zerone, Lisa, Princess. Maybe you're already ready. Again, listen to the mechanics. The mechanics is simple. In your screen, you will see a puzzle. There you go. And you simply need to find 5 words. Listen first. 5 words, you're already looking, that are related to the topic of our webinar. All right? Again, that's 5 words. But wait, here's the deal. You only have 2 minutes to find these 5 words. And the first 3 people who will comment all 5, all right? Or at least 3 of the 5 will be our winners. I'll repeat before I signal go. You only have 2 minutes to find these 5 words, and the first 3 people who will comment all the 5, of course, it's better if you get all 5, or at least 3 words, will be our winners for this game. All right? Diana, I know you're ready, but you need to type all 5 or at least 3. Okay, Diana? Here you go. I will do a countdown. 3, 2, 1, go! Go ahead and find the 5 words that are related in our topic for this webinar. All right, so while everyone's busy word hunting, or maybe typing down the words that they have found, on behalf of the Medical City Clark, if you want to know more about the Medical City Clark, we are on Facebook and Instagram. Okay, we are dropping the links in the chat box, or you can simply find us by typing the Medical City Clark. I repeat, we want to get in touch with you, so you may find the Medical City Clark in our social media accounts. That's both in Facebook and Instagram. So you can just scroll the chat, and perhaps one of our coordinators will put the link in the chat, or you can just simply type in the search engine of Facebook or Twitter, the Medical City Clark. All right, you have less than a minute to type in your answers, but I could see there were some of you were able to find 5. Let us check in our Facebook. How about in our Facebook? Come on, Facebook viewers. You're also included in the winners. So go ahead, if in case that you're able to find 5 words related in the topic of this webinar, go ahead, type them down. Lou Cortez, I can see you are typing. We have 13 seconds left before we close this game. The others are very good. So before I read them, just allow our participants to find the words themselves. 10 seconds, guys. 10 seconds. Go, 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 go. 5, 4, 3, 2, 1. Time's up. Time's up. Time's up. Time's up. Thank you for sending your guesses. All right. We will announce the winners after the talk. Okay, we'll announce the winners after the talk, so keep tuning in until the end for details. For now, I would invite you to prepare yourself as I introduce our speaker. So joining us today is Dr. Nicola Raphaela Tison, who will tell us more about breast health. Dr. Tison is a breast surgeon specializing in benign and malignant diseases of the breast. Currently, she is a consultant staff at the University of Santo Tomas Hospital, the Medical City Clark, and Pasig City General Hospital. She underwent breast surgical oncology fellowship training at the National Cancer Center, Singapore. In this webinar, Dr. Tison will walk us through breast cancer detection, prevention, and treatment. So grab your favorite drink because in just a while, we'll know more about breast health. Without further ado, please let us give Dr. Tison a warm welcome.
Hi, good afternoon. I'm Dr. Nicola Tison, and this afternoon I'll be discussing with you all Breast Health 101, risks, prevention, screening, and support. This is in line with our celebration of October being Breast Cancer Awareness Month. So, isang last pahabol to kasi end of October na. So I always emphasize to patients, with proper lifestyle choices and early detection, we can all beat breast cancer. So what are some facts and figures that we need to know about breast cancer? So worldwide, breast cancer is the most common cancer diagnosed among women and in all sexes. So in 2020, based on the World Health Organization, breast cancer accounted for 11.7% of all cancers diagnosed in both men and women. And in 2020, it was also the most common cancer diagnosed among women. So if you take a look at this map, almost everything is pink. The pink corresponds to breast cancer, and it was one of the most common cancers. It was really the top cancer diagnosed among women in 2020. It is also the top cause of mortality among women worldwide in 2020. So you'll see a very big part of this map is color pink. And you'll notice that a lot of the mortality happens in lower income countries such as the Philippines. So locally, what's our data? In 2020, we had a population of 109,500,000. And of all cancers diagnosed in the Philippines in 2020, once again, for both sexes, breast cancer accounted for the most number of cancers in both men and women. And very remarkably, amongst all women in 2020, it was really the leading cause of cancer, accounting for 31.4%. So this is just to, again, show to you that breast cancer is the most common cancer in both sexes and especially in women in the Philippines in 2020 and worldwide. So what are our risk factors for breast cancer? Many times, patients will ask me, Doc, why did I develop breast cancer? I have a very healthy lifestyle. Hindi ako umiinom, Doc. Hindi ako naninigarilyo. Gulay lang kinakain ko. Ba't ako nagkaroon ng breast cancer? So we always discuss with patients their risk factors. There are risk factors that are uncontrollable, meaning we can't do anything about it. But there are also risk factors that are controllable. So what are these? Gender and age. These are uncontrollable. So the mere fact that we are women, so I'm sure most of the people attending today are women. So the mere fact that we are female or women, and as the older we get, we already have the risk of developing breast cancer. So we can't control that. We can't change our sex. We can't stop aging. So this is something we cannot control. Genetic factors are another thing that we have no control. So some people have genetic mutations that runs in their family, and when you have these mutations, then these are beyond control also. One example would be the BRCA1 and 2 genes like Angelina Jolie. Also uncontrollable are risk factors like family history. So any type of cancer in the family, but especially breast cancer, ovarian cancer, these are linked to a higher risk of developing breast cancer. Another uncontrollable risk factor is radiation to the chest area. So we have some patients who were diagnosed with childhood cancers, nagka-leukemia nung bata sila, and they received radiation to the chest. So this is one risk factor for breast cancer. Other risk factors that are not controllable are some factors that increase our exposure to estrogen. So I always remind patients that anything that increases our exposure to estrogen increases our risk for developing breast cancer. And what are these? Early menarche, that means the age when you got your first menstrual period. So the younger you are when you get your first menstrual period, or late menopause, the older you are when you become menopause, then that means you had a longer span of time in your life that you were exposed to estrogen. And this increases your risk for breast cancer as well. Some controllable risk factors also related to estrogen would be having no children, giving birth at an older age, not breastfeeding, using hormone replacement therapy, and using hormonal birth control methods. So all of these also increase our risk or our exposure to estrogen. So I always tell patients, habang bata ka, have a family, if you can breastfeed ka ng matagal, because these are protective things. These can protect us from breast cancer. Other controllable risk factors include eating a lot of processed foods, lack of exercise, and obesity. So these things we can control. We can avoid processed foods. We can have a healthy lifestyle and do exercise and manage our weight. So for preventing breast cancer, it is very helpful to have regular exercise every week, maintain a healthy weight, limit the intake of processed foods and alcohol intake, because this is also linked to breast cancer, as well as smoking. Smoking is a very high risk factor for any kind of cancer. So while it cannot be totally prevented, like I discussed, we have so many uncontrollable risk factors, you can lower your risk of dying from breast cancer through breast cancer screening. So screening for breast cancer comprises of the following. So women of reproductive age, usually age 20 and above, we advise them to do their monthly self-breast examination, and I will show you later how it is done. Also, for all women of reproductive age, we recommend having a clinical breast examination every 1 to 3 years. So it's nice yung mga babaeng nagtatrabaho usually have a annual physical exam at work. So that's also very helpful to have a physician do the breast exam on you. But really, it is very important for a woman to do her self-breast exam. And then when a woman hits 40 years old, we already encourage them to have a screening mammography done. So this is just an example of a mammography of the left breast. So this is from the prior year and the current. And you will see that from having no lesion, on the picture on the right, there's already a new lesion. It's very small and the woman has no symptoms. But even without a palpable mass, we already catch it quite early in the mammography. So I always emphasize to patients, early detection is the key. Many times natatakot, Dok, ayoko magpamamo, baka may makita. Or they'll say, Dok, ayoko kapain yung breast ko, natatakot ako, baka may makapa akong bukol. So early detection is the key. And why is this? When we detect breast cancer very early, there's a big chance we get to save the breast. You don't need to undergo a mastectomy. It also decreases the chance of the patient needing chemotherapy. So when we get the cancer very early, many times a patient will not need to undergo chemotherapy, which a lot of patients are scared of. Ayaw nilang makalbo, takot sila sa side effects ng chemotherapy. So we can avoid that if we catch it early. And if it's very early, then there's a low chance of the cancer spreading to other parts of your body. And in essence, if we catch it very early, then you have a higher risk of living a long and normal life, cancer-free. So what are the common signs and symptoms of breast cancer? So most common would be a palpable mass or a palpable lump in the breast. So anytime anyone feels a lump on the breast, you must go and see your breast surgeon or a doctor to assess. Breast lump is the most common symptom of breast cancer, but I always tell patients it's the most common symptom of breast cancer, but most breast lumps are benign, meaning they're not cancerous. So it is important to get it checked and get it assessed so we know what to do next. Another common sign and symptom of breast cancer is nipple discharge. So it can be in both nipples or just one nipple. The color can be either clear, milky, yellow, or like in this picture, it can be bloody or blood stained. Any spontaneous nipple discharge must also be checked by a doctor. Another possible symptom is dimpling of the skin. So if you take a look at this picture, there seems to be an indentation. A lot of times you will notice this. This happens in the underside of the breast where the patient doesn't notice it when she looks in front of a mirror. Another sign of breast cancer or symptom is nipple retraction or inversion. So some women really have inverted nipples from like when they were younger, but any new retraction of the nipple is worrisome for breast cancer. Scaly lesions on the nipple are also worrisome. So sometimes it's just some allergy or eczema, but it still needs to be investigated because there are also breast cancers that may present this way. Another possible symptom of breast cancer would be redness or swelling of the breast, like this. So sometimes you can develop redness or swelling of the breast due to an infection. It's common in women who are breastfeeding, they develop mastitis, but it still needs to be checked because we have this thing called inflammatory breast cancer, wherein you don't really feel a breast lump, but the entire breast is swollen and red. So that needs to be investigated, see a doctor. Another possible symptom is changes to the skin texture, especially when it looks like this. It's very edematous, meaning parang namamanas yung breast. The pores are very prominent and it looks like an orange peel. So this finding in the breast is quite worrisome for breast cancer as well. And oftentimes, taken for granted is to check the armpit. So any lump in the armpit might be suspicious for an axillary lymph node. We do have some breast cancers wherein there's no lump in the breast, but you have a palpable axillary lymph node, and it turns out to be a lymph node with breast cancer in it. So pain. Most of the patients we see in clinic, they come in due to breast pain and are quite worried. Pain is not usually a symptom of breast cancer, so I always reassure patients that usually breast pain is quite reassuring. It means it's probably not cancer. But if you have persistent pain in the breast, especially if it is isolated or located in just one part of the breast, it's still very important for you to get checked by the doctor. So how do we perform a self-breast examination? So let's go through the steps, and I have a bit of an animation to show you how to go about doing your monthly self-breast exam. So when doing a self-breast exam, I always emphasize that you are the best person to detect any new lumps or changes in your breast. So some women really have very dense or lumpy breasts. You'll think there's a lump, but it's actually just breast tissue. So these women with lumpy breasts would be in the best position to notice anything new, any new lumps, or any changes to the breast. So we advise patients to check your breast at least once a month, and it is best done on the 7th day of your cycle. So kunyari, nagkaroon ka today, that's day 1 of your menses. And then you count 2, 3, 4, 5, 6, 7. Day 7 would be the best time to check. That's the time that the breasts are not so tender or painful and also not as lumpy. On the other hand, if you're already menopause, then you can just set one day every month when you will do your self-breast exam. So the first step of doing a self-breast exam is to stand in front of a mirror and just to check your breast and take a look at it and inspect your breasts. So check your breasts for any changes in size or shape. You check for thickening of the skin in the breast or underarm area, both sides. You check for swelling, warmth, redness, or darkening of the skin of the breast as well. Any dimpling or puckering of the breast skin needs to be checked by a doctor, or any itchy, scaly sore or rash on the nipple. Pulling in of the nipple or nipple retraction or pulling in of the skin in another part of the breast is also worrisome for breast cancer. So these are the things you look at in front of the mirror without even touching your breast yet. You take a look and compare. I always tell patients, usually, hindi talaga pantay yung breast. Meron talagang isang mas malaki dyan. But any significant change in the size or any increase in the asymmetry needs to be checked. So for the second part of the self-breast exam, patients need to raise their hands and look under the breast for the same changes I described earlier. So when you raise your hands above your head, you're able to assess the underside of the breast, especially for women with very large breasts. We usually miss out on the area underneath. So step 3 is to check nipples for any discharge or fluid secretion. It can be either milky, clear, reddish, or bloody. So sometimes women have a tendency to manipulate their nipples, and this leads to discharge. So what would be worrisome would be spontaneous nipple discharge that You just notice that there's a stain in your bra, on your shirt, without any manipulation to the breast. And step 4 is to lie down on your back and using slow circular motions, feel your breast for any kind of lump. So to check the right breast, use your left hand, and to check the left breast, you check your right hand. You can go in circles, starting from the nipple areola complex going outwards, being sure to check all of your breast, including the armpit, the inner part of the armpit. And then you do the same on the opposite side. And then step 5 is to do the same thing standing up. So you again, like this girl is doing, you feel the breast in circles, but you have to make sure to reach all the way to the collarbone, to the side, and to the middle part to be sure that we don't miss out on any areas. For the second part of our lecture, we're going to discuss some myths and facts about breast cancer. So these are the common questions that I get in the clinic. And later on, if you have any questions, feel free to ask them so we can address all your concerns or all the questions or all the things you hear about breast cancer that might be correct or might be wrong or might be fallacies or misconceptions. So very common. I remember when I was in high school, this was a big thing. Deodorant causes breast cancer. So no, this is not true. There's no scientific connection between the use of deodorants and developing breast cancer. So if you feel like you need your deodorant for your hygiene, go ahead. By all means, it will not increase your risk for developing breast cancer. Next, this is often a concern from patients. Radiation from mammograms causes breast cancer. So many times they'll say, Dok, paano yan? Parang every year, i-x-ray yung breast ko. Hindi ba mas magkaka-cancer ako niyan kasi nagkaka-radiation sa breast? So, hindi. Although there is some radiation, it is very low. The US FDA has an acceptable amount of radiation that we can receive every year, and that of mammogram is very low. It's actually almost equivalent to just background radiation of like riding an airplane. So although there is some radiation exposure, the risk of harm is very low compared to the benefit of being able to detect early breast cancer. Next, a lump is always a sign of breast cancer. So like I said earlier, although a breast lump is the most common symptom of breast cancer, many breast lumps are benign. So what's important is that if you feel anything, go see your doctor so that it can be worked up. And at least if it's benign, then you can get reassurance. You can sleep well at night knowing that it's nothing to worry about. And if it turns out to be cancer, it's very important that we get it while it's still very small. Next, only women with a family history are at risk. So I also get patients who will say, Doc, bakit ako nagka-breast cancer? Wala naman akong kamag-anak na may breast cancer or kahit anong cancer. Bakit ako nagkaroon? Wala naman sa pamilya. So only about 15% of individuals with breast cancer actually have a family history. So most women have no family history and it's sporadic. So here's a breakdown of the different breast cancers. 70 to 80% is sporadic, meaning there's no genetic predisposition, there is no family history, it just happens. 15 to 20% would be familial, meaning there is family history. And only 5 to 10% would have genetic mutations that would explain for the development of breast cancer. So, hindi porket wala kang family history, hindi ka na mag-screening. Kasi, like I said, basta babae, basta habang tumatanda tayo, tumataas yung risk natin for developing breast cancer. Next, underwire bras increase the risk of getting breast cancer. Again, there's no scientific evidence to support this. So, kahit anong bra na gusto mong suotin, pwede. Yung mga ayaw din mag-bra, pwede din. So, none of these will increase our risk for breast cancer. Next, there was also a time na may mga chismis din na hair, pag nagpapaday ng buhok or nagpapadiretso ng buhok, the chemicals can increase the risk for breast cancer. So again, this is not proven. There's also no link. So kung gusto mo magpaganda ng buhok, okay lang yan. Walang problema. Hindi ka magkaka-breast cancer dyan. Next, men can't get breast cancer. So 1% of breast cancers occur in men or in males. So although it's rare, it may occur in men. It commonly also presents as a lump, and any man who develops any breast cancer has to be worked up for any genetic mutations. Next, breast cancer always presents as a lump. So kanina, pinag-usapan na natin lahat ng signs and symptoms of breast cancer. So although having a lump is the most common symptom, there are other symptoms that could be breast cancer kahit walang lump, including swelling, warmth, redness or darkening of the breast, as well as changes in the size or shape of the breast, dimpling of the skin, nipple discharge, or nipple retraction. Next, an abnormal mammogram means I have breast cancer. So no, patients are always scared when they get the mammogram and they see the results saying that there's something suspicious. So many times we also get lesions on mammogram that look suspicious, but once we do the biopsy, they turn out to be benign. So most abnormalities on a mammogram are not breast cancer. But of course, we want to investigate. Gusto natin, pag may nakita tayong medyo hindi mukhang okay sa mammogram, mabiopsy natin kaagad, matanggal natin. If it's not cancer, edi masaya na tayo. But if it's cancer, then we get it quite early. Next, you cannot decrease your risk of getting breast cancer. So kanina, we spoke about all of the risk factors for breast cancer. And although a lot of it is uncontrollable, there are some factors that can be controlled, like limiting daily alcohol intake, eating a healthy diet, and avoiding processed foods that are high in salt, high in preservatives, having regular exercise, and also to stop smoking. All of these things can decrease our risk for developing breast cancer, as well as avoiding exogenous hormones like taking in oral contraceptive pills, or hormone replacement pills once you hit menopause. Next, all breast cancer is treated pretty much the same way. So many times, like in the past, maybe 20, 30 years ago, basta breast cancer, tatanggalin na yung breast ng babae, magki-chemotherapy. So right now, it's 2021, it's almost 2022, and we know that there are different kinds of breast cancer, and all the treatment is tailor-fitted to a patient. The patient's age, the patient's health, their status, what kind of breast cancer they have, the stage of the breast cancer. So iba-iba. Hindi porket may breast cancer, yung kapitbahay mo, pag nagka-breast cancer ka, pareho yung gagawin sa'yo. Last one, breast cancer only happens to middle-aged and older women. So like I mentioned earlier, we usually start screening mammograms at the age of 40 because it's more beneficial to older women. However, we still see a lot of cancer patients who are in their 20s and 30s. So any symptom in the breast needs to be investigated. So in 2017, 4% of invasive breast cancers were diagnosed in women under 40. That means 39 and below. And that means that 1 in every 25 breast cancers occurred in women under 40. So it doesn't matter how young you are. If you feel a lump in your breast, or if you see anything unusual when you do your self-breast exam, it is very important to go see a doctor. So thank you. We'll be open to answering any of your questions regarding breast cancer or anything regarding your breast health at that. Thank you.
Thank you, Dr. Nicola Tison, for sharing your expert knowledge with us. I've learned so much myself, and I'm sure the audience found this first part of the webinar helpful as well. Before we proceed with our Q&A, we have some trivia game for everyone. Okay, it's called Never Have I Ever. So maybe you have an idea of how this game is being played. There are tons of our friends using or trying out this game online, of course, but ours will be Breast Health Edition. All right, so never have I ever. On your screen right now, you will see a slide with 5 prompts. So we want you to read every line, and in your mind right now, we want you to assess yourself. So these prompts are answerable by yes or no. So we'll give you time, read each one, and assess yourself. Answer with a yes or with a no. If you answered yes, right, to 4 of the 5 questions or prompts, please comment it in the chat box right now or in the comment section in Facebook Live, right? Now, if you can't see the slide clearly, I'm going to read the prompts for you. The first one says, never have I ever known about the symptoms of breast cancer. Is it a yes or a no? So answer it first. Okay, with your assess yourself. Second prompt, never have I ever felt the pain in my breast area. Never have I ever felt the pain in my breast area. Third prompt, never have I ever consulted a doctor in regards to my breast concerns. Never have I ever consulted a doctor in regards to my breast concerns. Okay, 3 so far. Fourth prompt, never have I ever felt a lump in my upper body. Never have I ever felt a lump in my upper body. And our last prompt goes, never have I ever known the cause of breast cancer. Never have I ever known the cause of breast cancer. Now, if you answered yes to 4 out of 5, kindly type a big yes in our chat box here in WebEx or in the comment section of our Facebook Live. Can we check? Let's check our Facebook Live. How about those who are in WebEx? Any of you who answered 4 out of 5? Maybe they're still answering the prompts. Alright. Just check once more in our Facebook Live. None so far. Alright. If you answered 4 out of 5, it's actually time to see a breast specialist. Alright. If you answered 4 out of 5, Louise, thank you for sharing. It's a no for you. But if any one of you answered 4 out of 5, it is time to see a breast specialist. I remember my mother teaching us how to feel, our breasts and even our armpit. She's a nurse, the same with my father. And it's fascinating, how as a woman myself, I neglect no matter how many times she reminded me of checking. I neglect to, check myself and even see a breast specialist. For many reasons, like you say, we have no time or whatnot. This is despite my grandmother having died of cancer. So I believe Dr. Tison mentioned that earlier. But I am grateful indeed for this webinar. How about you? What statements are you most guilty of? You can share it with us in the chat box here in WebEx and even in our Facebook Live. Because as for myself, I am most guilty of not actually consulting a doctor with regards to my breast concerns. Yeah, all right. So for now, people, let us announce the 3 winners of our Guess the 5 Words. All right, let me just read them. Are you ready? These people who are very quick in finding the words in our puzzle earlier. So I would like to say congratulations to the 3 winners of our Guess the 5 Words. They are Micaela and Drino. Congratulations. Micaela, if you're still here, please put kindly chat here, message us here so we know. Micaela, congratulations. Also, congratulations to our second winner, Luis Lagasca. Luis, hi. I know you're there because you've been commenting. Congratulations, Luis. And our last winner for the Guess the 5 Words is Ayan. Oh, she also answered during our trivia game just now. Congratulations, Joanna Bascara. Ayan, so let me repeat, Micaela Endrino, Luis Lagasca, and Joanna Bascara. Congratulations, Luis. Thank you. Joanna, thank you. You may comment your full name and address here in the chat box, or you may reach out to us via our Facebook page so we can send you the details on how to claim your prize. All right, now for those who weren't able to score a prize yet, this is our final game. Okay, so be quick. It's called Guess the Brand. Oh, by the way, let me just mention the words. So we have breast, mammogram, screening, cancer, and women. Yeah, thank you for all those who participated in Guess the 5 Words, and congratulations again to our 3 winners. Even those who joined us in our Facebook Live, congratulations. Now, going back, our next game is called Guess the Brand. Listen carefully. I'll read the mechanics. It's pretty much the same as the first game. In a few moments, we will show you 6 brand logos. Alright, 6 brand logos. And the first 3 people, again, the first 3 who will correctly guess all 6 or at least 3 brands will receive prizes at the end of the webinar. And again, it's better if you guess all 6 brands. Okay, so try to reach 3, but then if you found some more, or if you guessed some more logos, go ahead and aim for 6. Okay, again, we will give you only 2 minutes for this round. If you're ready, can you type ready? Type ready in the comment. Type ready. Let's go. Type ready in the comment. Sheila, thank you. Diana is also ready. How about Joanna? Joanna's ready again, huh? Diane is also ready. Luis is ready again. Okay, so here we go. And what are the brands that you see on your screen right now? Let's go. Don't worry, you have 1 minute 30 seconds left to type in your answers. Oh, Villanueva. 3 so far. Kathy as well. 3. How about in our Facebook Live? Let me check. Anyone here? Oh, let me just give a shout out to Daday Sabio and Luisa Bautista for engaging in our trivia game earlier regarding the prompts, about breast concerns. Thank you. Less than a minute, people. Let me see. Some of you guessed 5. Oh, somebody guessed 6. Good job. Let's go. 3, 4. Let's see who were the first 3 who actually guessed the correct brand logos. 20 seconds for those who have not tried keying in their answers. Go ahead, you still have almost 10 seconds left. Ang bilis, ano? Speaking of bras, maybe we can have this myth about bras be clarified by Dr. Tison in just a while. I believe she mentioned that as well in her talk earlier regarding, what bra to wear, or even do we need to wear a bra. Thank you, Dr. Tison. All right, time is up. I believe 2 minutes is done. So we will announce again the winners in a bit. with details on how to claim your prizes. So, do you want to know those brand logos? Let's check if you got all 6 brand logos. Oh, thank you again, Daday Sabio. In our Facebook Live, also is joining us, trying to guess the brand logos. Thank you, Daday Sabio. Let me just check, are there anyone else that I missed here in our Facebook? So it's, being a woman, I just, I feel happy as well that that we are coming from a variety of age groups. And Dr. Tison earlier mentioned in her talk that actually the more that we age, the more that we are susceptible to cancer. So I think there's really no age limit as to getting informed ahead of time, right? Especially about breast concerns. Okay, Cagayan de Oro, thank you. Watching from Cagayan de Oro, Daday Sabio, and May Valencia Quinson, watching from Caloocan City. Luisa Bautista, watching from Olongapo, and Aji Ablis, watching from Mandaluyong. All right, let's see. So do you want to know what are the brand logos? Can you show them? They are so you see there, it's Bacol, Triumph, Avon, Calvin Klein, Bench, and Victoria's Secret. Now we have ayun pala yun. No? So those are the 6 brand logos. Sure, easy peasy and satin, right? Alright, in a while, we will announce the prize for this contest. Again, we'd like to thank Dr. Tison. We know how eager the audience is to, ask questions about our topic today. But before we head on to Q&A, there are actually tons of questions already. We're just going to announce the winner for our social media contest. A few days ago, we asked everyone on Facebook if you have questions about breast cancer, and many of you have participated. So, we have chosen 3 winners for the social media contest. And we will announce that in a while. I also have, while we're waiting for that, I also have the winners of our Guess the Brand game already. So here they are. Typing very fast is the first one. The first winner in our Guess the Brand game is Michael Villanueva. Michael, are you still here with us? Kindly comment down in the chat box. Congratulations for winning in our Guess the Brand game. Yay! Congratulations! Also, second winner of Guess the Brand is Erica Gonzalez, very active also in our webinar. Hi Erica, congratulations! You won. Yay! Thank you in our Guess the Brand. And sino kaya yung last? The last winner for Guess the Brand is maybe they're all hoping that myself, please call my name. Okay, the last winner for Guess the Brand is Sheena Marie. Congratulations. Sheena, if you're here, please comment. Yes, and also please state your full name, Sheena, so that I believe she commented it earlier. Sheena, your full name, so that we can also get in touch with you. Again, the Guess the Brand winners, Michael Villanueva, Erica Gonzalez, and Sheena Marie. Congratulations. And now let me just go back to the winners of the social media contest. Okay, now the winners for our social media contest are the following. Holy Dizon. Holy Dizon. Congratulations. Also, Riza Jane Gonzalez Lazo. The second winner of the social media contest is Riza Jane Gonzalez Lazo and Zila. Zila. So if you're watching, if you're here with us in WebEx, kindly type or message us in the chat box. Or if you're with us in our Facebook Live, please do the same. We want to get in touch with you. Congratulations once again to our winners of the Guess the Brand game and our social media contest. So our team will get in touch with you on how to claim your prize. Okay, but then again, you may comment your full name and email address on the chat box or reach out to us via our Facebook page so we can send you the details on how to claim your prize. Yay! So we have so far 9 winners, but I believe all of us here are winners because we were informed, right? We have additional information, knowledge about breast cancer detection and even how to screening, right? Self-screening or even in consulting our doctors. And speaking of our doctors, I know all of you guys have been meaning to ask Dr. Tison. And we have about 8 minutes to help you get clarity on what to do if ever you have breast health concerns. All right. So if you are here with us in WebEx, you may unmute yourself, right? Open your camera when you want to raise any question. So once again, I give the floor to Dr. Tison.
Hi, good afternoon, everyone. I hope everyone learned something from the short talk that I gave, and if there are any questions, we're open to answering them. Do you have any?
Yes, Dr. Tison, we have a lot. First, Dr. Tison, from our Facebook post by Holy Dizon of Angeles City, she's asking, is it normal that one breast is in a slightly different size? I believe you mentioned this earlier, Doc, than the other. Also, she has a follow-up. Can minors like teens and babies have breast cancer? Dr. Tison?
Okay, thanks for that question. So yeah, like I mentioned earlier, usually breasts are really not symmetrical, meaning one breast will usually be bigger than the others. In some women, it would 1 cup size difference, as big as that difference. So that's totally okay. It's only worrisome if there's any new increase in size or swelling of the breast. For the follow-up question is, I haven't encountered any case or read on any case report on breast cancer in a baby, but we do have breast cancer in young women as young as 16, 17, teenagers, especially those with genetic mutations and predispositions. So it is very important that not like in the olden days that if you get a breast lump in a young girl, you never think of cancer. Right now, regardless of age, we have to work up properly to see if there are any suspicious findings when we do our workup, like doing an ultrasound, to see if the patient needs a biopsy or not. So age is no longer a criteria for determining if a lump is benign or malignant. So yes, we do get breast cancer in very young patients. In babies, haven't encountered that yet.
But I'm sure, Dr. Tison, our participants were surprised, as myself, knowing that there were teens already being diagnosed of breast cancer. Thank you, Doc. Again, that's from the Holy Dizon of Angeles City. We have another, Doc, from Facebook as well, by Shane Donete. She said, pag sumasakit po ba ang suso ng babae, may chance po ba na related ito sa pagkakaroon ng bukol?
Okay, so many times, it's really normal for women to experience breast pain. So, pag may dadating sa klinik ko na masakit yung breast, I always reassure na that's usually due to the normal hormonal changes in a woman's body, especially during certain times of our menstrual cycle, like right before we're about to get our period, the breasts are very tender, and when you feel them, they're very lumpy. Now, is it related to having lumps? Yes, it can be related. There's this condition called fibrocystic change, wherein there's lumpiness or fibrocystic changes in the breast, and they sometimes become more prominent at the same time when the woman also experiences the breast pain because of the hormonal changes in the body. But more often of concern when a woman experiences breast pain, natatakot sila na maybe it's breast cancer. So if we don't feel a lump and there's breast pain, most likely it's nothing to worry about. But it's still best to get it checked to be sure. Kasi minsan you on your own, you can't feel anything, and then pag kami kinapan namin, meron pala kaming makakapan na lump.
So it's still better to seek our doctors. Thank you, Doc. Now I'll shift to WebEx because we also have questions here from our participants in WebEx. From Perlia Garcia, she's asking, Doc, what is the significance of bilateral enlargement of lymph nodes? But her breast cysts are benign.
Okay. So, not all enlarged lymph nodes mean breast cancer. So, sometimes, so you think of lymph nodes para silang tagasala ng blood or it will clean our blood. So, sometimes, pag nasugat ka sa kamay, o di kaya, ngayon, everyone's getting vaccinated for COVID. When we get this vaccination into our arm, it sometimes causes some reaction in our lymph nodes. Kaya sila lumalaki. Kasi they serve as a part of our immune system. They'll produce antibodies. So, nagiging mas prominent sila if there's anything going on in our arms or in our breast. It's okay. Minsan, meron talaga tayong lymph nodes in both sides. What's important is that they don't have any suspicious or malignant features. So, how do we know this? By physical exam, minsan we can tell kung suspicious, but really, more often than not, we will need a breast ultrasound and an ultrasound of the armpit to take a look at those lymph nodes. What do they look like? Because there are certain features under ultrasound that look suspicious, and there are certain features kahit malaki yung lymph node, mukha naman siyang benign. So, we will be able to see that by doing breast imaging. So, it probably has nothing to do with a breast cyst. Nagkataon lang, merong breast cysts, nagkataon merong malalaking lymph nodes. But more often, kapag may bukol sa breast na mukhang cancer, we really have to check for also involvement of the lymph nodes.
All right. I hope that one was clarified. Perla Garcia, who's here with us in WebEx. Now, I'll go back to Facebook. Dr. Tison, by Riza J. Lazo of Zambales. She's asking, normal po ba na pag hindi nireregla ay sumasakit din po? Kasi kanina, no, Doc, na-mention natin na pagka nagkakaroon, no, talagang parang magang-maga yung ating suso. Makirot po siya kahit wala din pong nakakapangbukol. 3 years na po kasi akong hindi nireregla. Dr. Tison?
Okay, I think the more important issue would be bakit hindi siya riniregla. And I would recommend na magpa-check up sa OB because it has to be worked up, the reason kung bakit 3 years na hindi ka pa rin riniregla. Does it have anything to do with the breast pain? Yes, it could. Kasi nga, pwedeng the reason na hindi ka nagre-regla is meron kang hormonal imbalances. So, yung hormones ito is also causing the proliferation of the breast and causing the pain. But I really think you have to get checked dun sa 3 years na hindi pagregla. It's not something na dapat hindi pansinin. Medyo mas importante yun for your case. So, pa-check up ka sa OB para makita kung bakit, ano ba yung cause kung bakit hindi ka nagme-mens.
Okay, so there you go, Riza. I hope you seek already medical advice. Ayan, thank you, Riza. Another FB post from Patricia Victoria from San Fernando, Pampanga. Ito, Doc, is related with the one I mentioned earlier, yung sa myth ng bra. Most people say na not wearing a bra has more pros or advantages than wearing one on a daily basis. But ang question niya, Doc, is nag-a-apply po ba ito sa mga babae na nasa cup C or D, knowing na mas mabigat daw po and it needs support? Doc?
So, like I said earlier, it doesn't matter what preference you have for bras. Or if you prefer not to wear a bra, it's also totally fine. But for larger breasted women, really the bras offer support and comfort. Sometimes it's very uncomfortable to, for example, you're doing exercises, diba? That's why we have sports bra. You need that support for the breast kasi masakit siya when you move. But if you're comfortable not wearing a bra, that's totally fine. However, syempre, given that we have gravity, if you have larger breasts and you don't wear a bra, then it is more likely also that your breasts will sag earlier than normal. Kasi as we get older, diba, tumatanda tayo, tumatanda din yung breast. So, pwedeng mas maaga siyang magsasag. So, it's really more of for support and for comfort. So, it's important for a woman to have a properly fitting bra. Not just any bra. So, minsan naka-bra pero it doesn't fit well. So, it defeats the purpose. So, a properly fitted bra that is comfortable. But if you're comfortable not wearing a bra, it also is totally okay. Walang problema doon.
Ayan. Once and for all, gets clarified by Dr. Tison. We have some more questions. So from Nueva Ecija, says Santos. She said, I've read po about breast conserving surgery. Sorry, Doc, if I'm mentioning the term incorrectly, please correct me na lang po.
Correct is correct.
Conserving surgery, yung lumpectomy. Is it correct po? How do I know if it's an option for me? Yeah, very good, Doc.
So that's a very good question. So right now, I'm an advocate for breast conserving surgery. As long as a patient is a good candidate, I try to convince them to go for breast conserving surgery and not for a mastectomy once they're diagnosed with breast cancer. But there are certain factors that have to be taken into consideration before we can offer breast conserving surgery to patients. Number one would be, is there only one breast cancer in that breast? Sometimes we have a breast with breast cancer in different areas of the breast, one in the outer part, one in the inner part. So for these patients, breast conserving surgery is not a good option. If the breast mass or the lump or the cancer is very large, or it is large in proportion to the breast, kasi if when we do the lumpectomy, we don't only remove the breast cancer, but we have to take a rim of normal tissue all around it. So if your breasts are not very large, sabi mo cup A breast ka lang, and then you have a cancer that's quite small, 2 cm. Sometimes even for just a 2 cm mass, for a woman with very small breasts, if we do breast conserving surgery, it would result in deformity. So it defeats the purpose of not removing the breast if after the surgery, ang pangit din ng cosmetic outcome. Kasi what we want is for a woman to have breasts that look exactly like it look normal and to have a normal life. Another reason that sometimes breast conserving surgery is not an option, especially we have women who live attending now who are in the provinces. So part and parcel of a breast conserving surgery is having to undergo radiation therapy. If you cannot receive radiation therapy, then we do not recommend breast conserving surgery kasi it only becomes equivalent with a mastectomy if after your surgery you also receive radiation. So kunyari, you live in a province that's far from any facility where you can receive radiation, then we don't usually offer breast conserving surgery unless the patient is willing to travel to, say for instance, travel to more developed area or province where they can receive the treatment. Kasi daily treatments yun eh. And other factors would also be the findings on your mammogram. So sometimes the mass is very small, but on mammogram, it's very extensive. So your doctor or your surgeon will have to take into consideration many factors before being able to offer this to you. But that's why I said we really advocate breast screening and early breast cancer detection. Kasi if it's something found on mammogram and there's no lump, there's a very high likelihood that we can do breast conserving surgery. No need to do a mastectomy.
All right, thank you, Doc. That's again for Ces Santos of Nueva Ecija. Another question. She says, "Hello, Doc. Tess from Caloocan City. I'm doing treatment right now, but also I've been trying to keep healthy. Can I exercise during treatment? If so, what kind of exercise should I do and how often?"
Okay. So I'm not sure what treatment she's undergoing, but we do advocate a patient to do moderate exercise. That means about 2.5 hours every week. For patients on chemotherapy, we try to shy away from very strenuous exercise like Zumba and stuff like that, because the immune system of the patient is down. Sometimes they're anemic because of the chemotherapy. But weight-bearing exercises is good, like walking, even walking around your house, walking up and down stairs is okay. But if you're already done with your chemotherapy and you're doing radiation or anything after that, like if you're taking hormonal therapy, then you can do any exercise that you were doing before you were diagnosed with cancer. If you're doing yoga, if you like to play sports, it's totally fine. Sometimes you just advise against activities on the affected arm. For example, you had the right breast cancer where they had to remove all the axillary lymph nodes. Then we advise the patient, wag ka na lang mag-tennis kasi sometimes they develop lymphedema. So it's case to case. But in general, we advise patients, even those undergoing treatment for breast cancer, to do exercise. It's very beneficial to breast cancer patients and to all of us as well.
So they can exercise. It's encouraged. Thank you,
Yes.
Doc. Question now from Webex Rose Nunag. Is there a link between women who are in their premenopausal or menopausal stage to have a persistent breast pain but no signs or evidence of lump? Thank you po.
Yes. So oftentimes I get patients who are almost in the perimenopausal. That means they're not yet in the menopausal period, but they're already aging. And sometimes due to the hormonal changes, all of a sudden they feel breast pain. It's common in young women who are premenopausal kasi regular yung cycles. It's more common to be cyclical, meaning every month you get it before you get your period. But for older women, sometimes due to the derangements in the hormones when you're about to be menopause, then it can still be related. So breast pain is totally normal as long as it's not debilitating. Usually we advise patients to just avoid caffeine because that can aggravate it. So less coffee. If it's really bothering you, you can take pain relievers. So the breast pain is only really worrisome if there's an associated lump or if there are any signs of infection, like if it's red or swollen or tender. It might be an infection, that's why it's painful. But otherwise, the usual breast pain usually is really not very worrisome.
Alright. Kasi pagka may breast pain na kinakabahan na agad, Doc. Okay. Another...
I always tell patients, mas gusto ko yung kinakabahan. Mas gusto ko yung medyo praning, tas magpapacheck kaysa yung pinapabayaan lang. So it's totally okay. Kasi minsan patients will be, Doc, sorry napapraning lang ako. And we appreciate that. It's better that we take care of ourselves. If we feel anything, just get it checked para sure tayo.
Ayun. Thank you, Doc. Ako din ay medyo nakalma. Another question, Doc, from Faith here in our Webex. Ang question niya po is, has 6 by 4 millimeter lobulated nodule benign? Is this ACT BIRADS 3A? Okay. Does it need to be removed to prevent it developing from cancer? There you go.
Sige, mukhang siya to Puntahan mo na lang ako sa clinic. 6 by 4 millimeter not centimeter. So, itong BIRADS, if you read the one sa WebEx, if it says BIRADS, that's a category on breast imaging. And it tells us if a lesion is suspicious for cancer or not. When you say BIRADS 3, that's probably benign. And the risk of it being malignant is only 0 to 2%. So there's only a 0 to 2% chance that this 6 millimeter nodule is malignant. So usually for lesions that are BIRADS 3, and then it's sub-centimeter, meaning it's only 6 millimeters, we don't have to do anything except monitor. So for you, Faith, you have to repeat your ultrasound in 6 months, and then every 6 months for 2 years, just to make sure that it remains the same size and there are no changes in the appearance that will make it look suspicious. So usually after 2 years, kung di nagbago yan, bababa na yan to BIRADS 2, which is benign, which means there's essentially 0 chance na cancer or malignant yung nakikita na yan on your breast.
Okay, now I learned the new word also, BIRAD.
Yeah.
Okay.
BIRADS.
Thank you po. Doc, Rose who actually asked earlier, no, sabi niya, yung sa premenopausal at menopausal, She says, will advise my mother to limit caffeine intake. Ayan, thank you
Mahilig
daw.
kape.
Thank you daw po.
You're
Last two
welcome.
questions, Doc. One from Lynn here in WebEx. I guess I have a breast lump. Can I consult my OB first or should I directly visit a surgeon?
I strongly advise if you already feel a lump is to already see a surgeon. Kasi when you see the OB, they'll also refer you to a surgeon. And then sometimes kasi kulang yung nare-request na test ng OB. A lot of times they request lang for a breast ultrasound. So it depends on our physical exam if we feel you will need a mammogram, or it depends on your age and other factors. So if you already feel a lump, it is best to really see a surgeon. A lot of times women go to OB kasi babae. But ngayon madami naman ng breast surgeons or general surgeons who are female. So just find somebody you're comfortable with. But a surgeon would know better what to do with these breast lumps compared yung OB, hindi nila operahan naman yan or iba-biopsy. They would refer you dun to a surgeon. So sayang pa yung nakadalawang consult ka. Diretso ka na.
Thank you, Dr. Tison. Last question. This is asked by Anonymous. Hello, Doc. Does breast size affect your risk of breast cancer? Like being flat-chested or big breast? Ayan, I think may myth din dito, Doc eh. May effect ba daw po yun, yung size? Doc?
Okay. So, di ba they would say, kasi mas madami yung breast tissue ng malaking breast, mas malaki yung risk for cancer. But no, that's not true. Usually, what would be more correlated with a higher risk of cancer would be density. So, may mga certain women, like, they don't have very large breasts, but they're very dense. Meaning, when you feel it, it's very lumpy. When you do a mammogram, it's very dense. Puro puti lang makikita mo. So, yung mga ganong breasts have a slightly higher risk na of developing cancer, and it's also a bit harder to detect on mammogram because they're very dense. But in terms of size, wala siyang correlation like for larger or smaller breasts having a higher risk of developing breast cancer.
Alright. Ayan. Thank you. Ayan, from Faith, Doc. Thank you daw po. I will have my ultrasound next week. Thank you. Alright. I guess, Doc, we were all paying attention. No, everybody's paying attention with your answers to our question. So, again, Dr. Tison, we thank you for helping us understand our breast health better. And I hope the people in the audience, I'm sure you've learned something new from this lecture. But of course, the most important takeaway here is to practice, right, Doc? Practice the things that we learn. Yan. From the presentation of Dr. Tison, to look after our health better, right? Can you type yes in the chat if you're going to apply what you've learned here? Let's show Dr. Tison our commitment. Ayan. Thank you, Faith, Erica. Ayan, that will make Dr. Tison happy also.
Yes,
Thank
very
you.
happy. Yes.
Ayan, Dr. Tison, once again, we thank you for giving us this very informative talk and answering our questions. Once again, from on behalf of the audience, thank you very much, Dr. Tison.
Thank you. Thank you all for listening.
Okay, so before we end the webinar, may I request everyone to turn on their camera so that we can take a group picture? Can we do that? Those who are comfortable turning on their cameras, can you please turn on anyone who's turned on their camera? Yan. Now we see them. Yay. Okay, so I will count 3, 2, 1, and then you say breast health. That will be the cue for our photo opportunity. Okay, are we all ready? Can I also get a cue from our coordinators if we're ready for the photo op so I can count? All right. Yes. So yeah. Yay! There's also a baby there. Hello, baby. My son is also walking behind me. All right. We're ready for the photo. All right. 3, 2, 1, and then say breast health. Okay. Mute or unmute yourself. It's fine. All right, ready? 3, 2, 1. Breast health.
Breast health.
Health.
Okay, did we capture that? Are we good? Are we good po? Yeah. All smiles with our audience. Yay! All right. Thank you once again, Doctor. There are lots of acknowledgement and thanks here in our chat box. And before we part ways, we have an exciting giveaway, especially if you haven't followed the Medical City Clark yet on social media. This is the perfect time to do that. We have partnered with Hilton Clarkson Valley Resort. So shown on your screen right now are the mechanics. So it's so easy to join. Just follow these 4 steps and you'll get a chance to win an overnight stay at the new and fabulous Hilton Clark. We will post the details of this exciting giveaway on our Facebook page, so stay tuned. So, I guess that's it from everyone here at the Medical City Clark. We thank everyone who participated in this webinar. Once again, we thank, of course, Dr. Tison for joining us, for giving her very informative and comprehensive discussion on breast health. And also thank you to our very participative audience here in WebEx and even in our Facebook Live. Even though we are mediated by a screen, we were able to still, enjoy this webinar this afternoon. So, from everyone here at the Medical City Clark, we thank everyone who participated. For our game winners, once again, you'll each get a souvenir or the TMCC Care Kit. Please do leave your full name and email address or send us a private message on our Facebook page so we can contact you regarding your TMCC Care Kit. If you have further questions, you can always visit our Facebook and Instagram pages and message us. Thank you, everyone. Always remember that when it comes to breast health, prevention is always better than cure. Until next time.
A breast self-exam is an examination of the breast for changes or abnormalities. Adult women of all ages are encouraged to perform breast self-exams at least once a month. There are 3 ways to perform a breast self-exam.
Lying down. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around your right breast, gently in small circular motions, covering the entire breast area and armpit.
Use a light, medium, and firm pressure. Squeeze the nipple. Check for discharge and lumps. Repeat the steps for your left breast. In front of a mirror, visually inspect your breast with your arms at your sides. Next, raise your arms high overhead. Look for any changes in the contour, any swelling or dimpling of the skin, or changes in the nipples. Next, rest your palms on your hips and press firmly to flex your chest muscles. Left and right breast will not exactly match. Few women's breasts do, so look for any dimpling, puckering, or changes, particularly on one side. In the shower, using the pads of your fingers, move around your entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and armpit area. Always remember that any changes or abnormalities should be discussed with your doctor or physician.
I am Dr. from TMC Clark. So here I am because it's October and October is Breast Cancer Awareness Month. I would like to explain to you more about breast screening. So you see, breast cancer is very common in the Philippines and actually all over the world. So it's important that we know the value and appreciate the value of breast screening. Breast screening means that even if we don't have any abnormalities or we don't have any complaints, we come in for a physical exam or any sort of examination to make sure that there are no abnormalities in the breast. Beginning the age of 20, we recommend that a female do a monthly clinical self-breast exam, meaning a week or so after your period, you inspect and palpate your breasts. If you do this monthly, more or less, you'll be more familiar with the own texture of your own breasts and be able to report to us, your doctors, if there is anything new. Beginning the age of 30, aside from your monthly self-breast exam, we recommend that you do an annual clinical breast exam. So come see us once a year so that we can also do your physical exam for you and help you with any problems. Beginning the age of 40, aside from your monthly self-breast exam and your annual clinical breast exam, we recommend an annual mammogram and ultrasound. The mammogram and ultrasound are done so that we can catch anything that is growing in your breasts. Breast masses start very small and sometimes you can see them early enough when you do your annual mammogram and ultrasound. So, with breast cancer, we would like to catch it early. Breast cancer is really not preventable. What we want is that if ever a patient will get it, we catch it early so that cure can be possible. So once again, we hope to see you. It's October. It's Breast Cancer Awareness Month. Come in for your screening.